Hi, everybody. I believe I'm live. I'm doing this again. I never actually know when I'm live or not, but it says I'm live, so I'm assuming I'm a little bit early here. So I know I said I'd be coming on at 7 p.m. Eastern time, but I figured I'd come on a little bit early in case I had some early birds with me. Let's see here. And this way, you guys can let me know if you have any questions, comments. I just did a hello in the chat box here, so that way everybody can see. This is my second live, so please forgive me if I do something wrong. I do know from last time, I realized the chat, like the comments in the chat didn't actually save. So I will try to read the comments out loud this time. So for those of you guys who look at the recording afterwards, you'll kind of know what we were talking about. So hi, Miranda. Hello, hello. This is just a question and answer for hygiene, assisting, dental, basically anything. If you guys have any dental questions, if you guys have any questions about any courses, whatever you guys want, if you just want to chat, everybody really liked the live that I did last time, which is fantastic. So that's why I wanted to come on again. And I did have a lot of emails about my new teeth whitening technician training course. So I wanted to talk to you guys about that as well. Ebony, nice to see you again. Hello. Oh, you had passed. That's amazing. You must feel so happy to have passed your exam. Hopefully you did some celebration of some kind, I guess with Valentine's Day and everything. So that's even more special, right? Nothing wrong with that. Thanks for hopping on again. And Ebony, did you learn about this live YouTube? I posted in the community on YouTube, but I don't know if I did it properly. So I was just curious if this is how you found out about it. People were telling me last time that you get a notification when I come on live. Definitely a huge relief for sure. So you guys, if anybody has comments, questions, feel free to type in the chat box and I will absolutely answer them, of course. If I don't have questions, I'm just going to talk. I did get some questions over email. I feel like I have to sneeze again. Why does this always happen when I do a live video? It doesn't happen when I'm doing my actual videos, but it happens when I'm doing my live videos. So that's hilarious. Oh, Sonia, I just sent you an email about the working interview question. I literally just made a new video for you on working interviews about 20 minutes ago. So definitely look at that link. I literally explained everything about how the working interview goes and what we expect. I'll do kind of a recap for you here since you did ask. Basically, work interviews, you don't have to be as nervous as it probably sounds. I remember doing them too. We're always going to be nervous. Anytime we work somewhere new, we're nervous, right? Like even me, when I'm not nervous, but when I see a new patient, you have that feeling of, oh, this is a new person. How are things going to go? So it's the same thing as working in an office. Just basically treat it as if you're working there. Do the best you can. Nobody expects you to be perfect. Ask questions if you have questions, but don't ask too many questions and be annoying. Help out if there's no patients. Take initiative. Seat the patient right away. If you don't know how, ask. What else did I say in the video? Isn't that so funny? I just did the video and now I'm trying to think. If it's a slow day, ask other staff members if they need help, the dental hygienist, dental assistant, the dental receptionist. I did say at the end of the day, thank the staff for having you. If you managed, if the office manager set up the working interview for you, then make sure to stop in at the end of the day and say thank you and you'd love to work there. If the dentist set up the interview for you, stop in, say hi, thank you so much. It was great to work with you. But watch the video. I did send you the link. It's not published live on, it's not published yet on YouTube yet. That will probably be in a couple days, but I did send you the link. You're very welcome. Oh, Ebony, great question. Do I have any funny stories about work that I can share? Good question. I guess I should have thought about that, eh? I did upload some YouTube videos like years ago of just like funny work stories. Now that I have my own business, I kind of feel like my patients are not as, how do I say this, not as weird. Like I don't have as many funny stories. Ebony, I can't think of any right now. I actually can't. Um, oh my gosh. I feel silly, but I can't think of any funny stories. I mean, I guess some funny stories with kids, like kids will say the weirdest things. I have kids sometimes where they're so shy and so nervous when they see the dentist. So that's why the mom or dad booked me in to go see them mobile at their home. And the kids are so hyper. They're so happy. They love it. They jump into the chair right away. They can't wait to brush my stuffed animal's teeth. So that's pretty funny, but not like a weird story or like funny story, I suppose. Kids are a lot of fun. Oh, there are two Sonyas. Look at that. That doesn't happen too often. Hamo, sorry if I pronounced your name wrong. Can I explain the oral cavity? So what do you mean? Like, what is the oral cavity? Are you a dental professional or just somebody who's curious about the oral cavity? The oral cavity is basically inside the mouth. So the oral cavity is anything inside the mouth. So teeth, the tissues, the tongue, the insides of the cheeks, the palate. The oral cavity is kind of what the dental professional works on, either dental assisting, dental hygiene. We are in the oral cavity, I guess, if that makes sense. I can tell you guys some weird stories. Like now that I'm a mobile dental hygienist, I have to think of things like today. I had a snow day. We got so much snow. I'm sure I would have been fine to travel, but I had like a foot of snow in my driveway. That's going to take forever. I was very sore after shoveling that. And I have to think about things like, oh, well, will my patient have time to shovel their driveway? Or am I going to be stuck on the road lugging in my compressor, all of my bags, the patient chair? That's not happening. It's just not worth it. So if we get a lot of snow, I call it a snow day and I do not see patients. Not all the time. Like if I kind of feel like it's fine, I do have some patients that, probably don't think to shovel their driveway before I come, or they can't, or they don't shovel their porch or something. So it's pretty funny to kind of see me maneuver over. So I make sure to wear my big, long, like boots. I'm like maneuvering over with all my stuff. I come in and they're kind of like, oh my God, I didn't even think to shovel the driveway or my porch. I'm so sorry. And I feel weird saying, can you please shovel the driveway for me before I arrive? I don't like to do that. So that's kind of something you have to think about as a mobile dental hygienist. I definitely had to be careful where like there's ice. I don't want to slip and fall and hurt myself walking up to a patient's front door, things like that. Oh my goodness, Ebony, here's a funny story for you talking about being careful driving. So thank you for thinking of me. I ran out of windshield washer fluid in the middle of the highway the other day. You would think your car would alert you when your windshield wiper fluid is like almost gone, but mine didn't. And it's a brand new car, so kind of strange. But I ran out of windshield washer fluid. I needed it. So I opened up the sunroof and I had my water bottle and I'm like squirting water. Yeah. Probably dangerous, but it's a lot worse driving when I can't see. So then as soon as I could finally get to a gas station, I bought some windshield washer fluid. I've never filled it up myself before. So thank you, YouTube. I did a quick YouTube check on how to do it. Easy, actually. I've never even lifted up my hood before, so I didn't even know how to do that, but I did it. And then guess what? I couldn't open the container of the windshield washer fluid. Has anybody ever had trouble opening that container before? It's like childproof times 3. And my hands and like fingers were so cold, I couldn't squeeze the cap. So I had to ask for help. That's my funny story for you. The Yukon province. Sonia, good question. So Sonia's question is, do I know if you want to work in a Yukon province, which should we be registered? I'm not sure, and I wish I could look that up for you, but I get many emails and questions about different provinces. The easiest thing to do is send an email to the CDHO, as you had mentioned, and ask them, and they will tell you. If you aren't to be registered with them, they would at least tell you where to go. In fact, I can do a quick search online for you, but I can't promise I'll find anything. Let's see. You know what? Just a quick search. I think you would be with the CDHO, but I don't know for sure. So definitely look that up, okay? Sorry, I wish I could be more helpful, but that's my guess. And that actually brings me to my next point. I've been getting emails about my new teeth whitening course that I do offer. So I do offer a full teeth whitening technician training course. In some provinces, in some states, you do not have to be a dental professional to be a teeth whitening technician. So I offer the course for everybody. You could be a hairstylist who wants to do something on the side. You could be a lash technician who wants to do something on the side. I offer full training for teeth whitening online. And your clinical exam is done online also. So you don't have to do it in person with me. I have everything set up so you can do it online. And my course is different because I offer a full business component. So I don't just teach you about teeth whitening and then say, okay, goodbye, here's your certificate, good luck, see you later. I offer a full business component, so I make sure you actually succeed in your teeth whitening business. So I can leave you guys the link down here if you want to check it out. It's whiteteethschool, I know, .com. whiteteethschool.com. For the recording, you'll see the link in the description. So I get a lot of questions and comments about teeth whitening, and the common question is, can I be a teeth whitening technician? I suggest you contact, whether you're a dental professional or not, look up your local dental hygiene association or dental assisting association and email them and ask them if you can open up your own teeth whitening business. I know if you're not a dental professional, you might be wondering, why am I emailing the dental hygiene or dental assisting association when I'm not a dental professional? But they will give you the answer. They will tell you if you have to be a dental professional or not. And even in some areas, if you're a dental professional, you can't just open up your own teeth whitening business. You need additional qualifications, but some you do not. So I suggest checking. And then if you're allowed, come to me. I will teach you guys how to do it, plus a full business component. We meet online as well. So you get the full course, which is 80 hours of teeth whitening material that you are learning. It's not a tiny course, you guys. It's a full-on course and business component. But we meet once a month like this, where we talk about your teeth whitening journey, your questions, your business, all of that, so you can succeed. Okay, so that's a very common question. I hope this helps to clear that up. It's easier for me to talk about it live than it is to answer all of those questions in the YouTube comments, but I'll probably do it anyway. But so I hope that helps you guys. I'm just checking out the other questions. Hi, oh good, I am so happy that you like my channel, thank you. Oh, that's exciting. So the beginning of April, you will be starting a dental assisting course. That's amazing. I'm so happy. If you need help, let me know, because I do offer a full dental assisting board exam prep academy. So if you need help, I would love to help you. I was a dental assistant first as well, 15 years ago, and I love the dental assisting profession. I love the dental profession. But dental assisting is amazing because everybody looks for you for help. Like you are the hub of the practice. Just you wait. Dental assisting is amazing. I am a dental hygienist right now with my own business, if you didn't know that, but I was a dental assistant first. Oh, Hope. Hello, Hope. Hope is just saying that her 10-year-old's right canine tooth is loose and her permanent is already out. Any tips on removing it painlessly? Painlessly. Very good question. I see this a lot. Just have her wiggle, wiggle, wiggle. Wiggle, wiggle, wiggle. You can help her too. Have her bite into an apple, but she probably won't want to do that. Just wiggle, wiggle, wiggle is the best thing to do, honestly. If you take a full Kleenex, which of course I don't have here, but take a full Kleenex and just like put the tooth in the Kleenex and like wiggle, 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 say, okay, let's count to 5. That really helps if she lets you. And tell her she'll get money from the tooth fairy if the tooth comes out. Hakan, I hope I pronounced your name right. Hello. Good question. So Mig, sorry if I didn't pronounce your name right, is asking what are the procedures that you are allowed to perform if you don't have a license yet? Are you referring to dental, or sorry, being a dentist, a dental assistant, a dental hygienist, or are you referring to teeth whitening? Let me know. And I believe I'm recording this, you guys. I can't remember. I think it asked me if I wanted to record it last time, and I just clicked yes. So I hope that worked. Okay, so as a dental assistant, you probably can't do much until you have your license. You might be able to open up your own teeth whitening business, talking about teeth whitening, if you wanted to do that. But you cannot do any dental assisting duties unless you have your license. That is a for sure. Same with dental hygiene. You can't do any dental hygiene duties unless you have your license. So I hope that helps. Very good question. So somebody's asking me any tips for debridement on a client for the first time. They are a dental hygiene student. I remember that day as clear as crystal. I barely touched the teeth. I was so freaking nervous. Oh my God. I can't really give you any tips because it depends on your comfort level. All I can say is don't be afraid of hurting the client. You probably won't. Obviously, be careful. But my mistake was I was too careful that I barely touched the teeth. Don't be afraid to get right in there, okay? I don't know if you can go, like, do you feel comfortable asking your dental assistant, dental hygienist in the office that you might go to and say, hey, can I just watch you clean a patient's teeth? And can you like give me tips on what to do, what not to do? Because if you were here, I'd be happy to give you like actual clinical tips, but it's kind of hard. Just you're going to be nervous. That's normal. I was very nervous. I probably failed my first client because I barely touched them, but don't be afraid to get right in there. So I hope that helps. Great question. So somebody says that they wear full dentures and take them out overnight and keep them in during the day while short naps. Yes, I think that's fine. Just the main thing is that you are taking them out at nighttime and, you know, cleaning them. The main reason to take your dentures out at night is so your mouth can, you know, sort of breathe, if that makes sense. Because if the dentures are in all the time, your mouth and gum tissues can't breathe properly. So then you can get infections, you can get sores. So it's best to take them out at night, like just to allow that healing to happen, if that makes sense. Short naps, I think is fine. It can't hurt to take them out though, but I think it's fine to leave them in too. Unless you are noticing like sores inside the mouth, if your mouth is just not feeling comfortable, then you might want to start taking them out more, but I think you should be fine. Meg, good. I do hope that that helped. And Christina's asking for dental assisting. Are there certificates and a license? If so, how do you get a dental assistant license? Great question. So yes, to be a dental assistant, you do need a certificate. Not really a license, it's more like a certificate, but you do have to be trained to be a dental assistant. Depending on where you live, I do suggest just simply looking up online dental assisting training, dental assisting schools, and a bunch will pop up for you because it does depend on where you live. It varies. It could be 11 months, it could be 6 months, it could be 2 years. Every course is different depending on where you live. Talking about teeth whitening, you might be able to open up your own teeth whitening business without having a license. I know a lot of dental assisting students who do actually open up their own teeth whitening business because they want to kind of do something and start that first, and then they realize how much they love it and they want to become a dental assistant after that. So you don't necessarily need a license to have your own teeth whitening business, depending on where you live. If that helps, Christine. And somebody's asking, how long does it take to say if a root canal treatment is successful? Great question. Depends on the dentist doing it. They might tell you, I'm not really sure about this root canal. Let's wait 3 months to see if it actually took. Or they might know right away. The key is if they take an x-ray after the treatment to see how the tooth is at that time. And then the next time you see them, probably in 3 months, to really see if the root canal has taken properly, they'll take another x-ray and then compare the two. If they still notice a black, we call it a radiolucent area, then the infection is still present or that's not a healthy tooth. If there's no black radiolucent areas, then the root canal has been successful. So I hope that that helps. Sonia, good question. So Sonia's asking about tips on temping. So I was a temp for a long time. Sonia, are you referring to temp as a dental assistant? I think so, right? Or dental hygiene? No, I think dental assisting, right? Well, either or I suppose is fine. Temping is hard because you're in a different office every time. So if you get like butterflies, anxiety every time you work in a different office, then that's going to be hard for you. You know, like I didn't mind working in different offices, but I did kind of like it when I just worked in the one office because at least I knew what to expect. But the kind of nice thing about temping is you can get in and get out. So if you don't like the staff, it's like, okay, bye, see you later. And then you don't have to work there again. And temping, offices love you because you're helping them out, right? They've probably looked for a temp because somebody called in sick, somebody keeps calling in sick, or they just can't hire somebody full time because there's nobody out there. So temps get paid more and they're so much more appreciative of you. Check out my YouTube channel and type in temping. I have a lot of videos about temping because I used to be a temp as well. So Christine, good. I do hope that that helped. Any other questions, you guys? It can be about anything. It can be about dental. It can be about my courses. It can be about your teeth, whatever you want. Because after we do the Facebook Live, I will be uploading a new video, or I should say videos, because it's my video night tonight. So I'll be uploading a bunch. Speaking of which, does anybody have any video topics that they want me to talk about? Shia, good question. I went to a private college and I loved it. I don't want to say I loved it because it was a very tough program and I hated it, but I mean, I wouldn't have done anything different. So a private college, you typically pay more, but you get in right away. As long as you have the marks to stay there, you're fine. Whereas a public college, for me, I couldn't get into any of them because I needed like a 95% back in the day. And I had a 92%, which wasn't good enough. So I looked into private colleges and they accepted me right away. You do have to pay a little bit more usually, but you get done in a shorter period of time because it's an accelerated program. So you work harder, but it's worth it. So I went to a private college in Toronto. Even for dental assisting, I went to a private college in London, London, Ontario, not London, England. For dental hygiene, I went to a private college in Toronto, if that helps. And for my restorative program, I actually went to a public college. Yeah. I kind of forgot about that in Ottawa. David, good question. So David's asking, how can I be better at debridement? You know what? It takes practice. And if you don't feel confident in your skills, I suggest taking a hands-on course. We can all learn from hands-on courses. I would love to take a hands-on course to sort of upgrade my teeth cleaning abilities. But with COVID, there just hasn't been any offered right now. But once they start that again, I would like to take a teeth cleaning, course to update my, skills, try maybe different instruments. That's the best thing to do. And practice does make perfect. I'm sure I'm not perfect. We can always learn something. I hope that helps, but that is truly the best way to get better at it. I probably wasn't very good when I first started, but now 15 years later, I'm probably a lot better, you would hope, than if I had just started. So it does take time. It takes practice. Great question. So somebody's asking, did I find going back for restorative more difficult than your original program? I want to say no, it was not more difficult just because I kind of had the background knowledge already. I knew what to expect. It was just kind of additional skills. But the restorative program was not easy. Oh my Lord. Basically, we learned something like we would learn how to fill the teeth using amalgam fillings. That afternoon, we'd be seeing a patient, an actual live person. Actually, no, sorry, that's not true. It could have been one day we learned how to do, let's just say, amalgam fillings, and then that afternoon we did it on like a typodont, so like a fake person. But then the next day we did it on a real live person. So that was difficult. It was stressful, but I'm glad I have that skill. I learned more when I started doing it on real people in the dental office because I had a mentor to kind of walk me through everything. He was extremely helpful. So would I say it was more difficult than my dental hygiene program? No, just because dental hygiene is a lot longer and you see more patients, if that makes sense. It's kind of like a different category altogether. Zakia is asking, can you give me some examples of university interview ethical scenario questions and how to answer them? Ooh, that's a good question. Ethical. I haven't been a part of that interview process, so I don't know. But my guess is they might say something like, you know what? I don't know. What would they say? You know what? I don't know. I don't want to give you bad advice. I've never been a part of that, but it's just probably like everyday ethics. Like, what do you do if a patient can't pay for their treatment, but they're in so much pain? Do you send them on their way? Yes or no? What would you do? You would probably treat them, but then work out a payment plan, work out something. If they said, well, they can't pay, well, work out a better treatment plan, something like that. That's my guess on what they would be talking about, but I don't know. I'm sorry, I can't really answer that. Shayha is asking, have you ever experienced a dentist or employer looking down on a private college education? Actually, no, never. That's a great question. I have never. In fact, a lot of employers and dentists, like honestly, don't even look at where you went to college or university, just as long as you graduated. That's a great question. But yeah, no, never had a problem, like ever, like not even for a second. They're just happy you have graduated, to be honest. Smile therapy, my pleasure. I am very happy to have this channel. How long has it been now? I want to say 5 or 6 years, maybe even 7 years now. If you guys look at my last video or my like first videos, they were probably really bad. So thank you for continuing to watch me. I love to help. Your question is, when I first started doing house visits, what was it like with the mobile unit and the noise level? How did you manage that? You know what? That's a great question too, because when I first heard my compressor unit, it was loud, so much so where I looked into getting like noise canceling blankets to put over top of it, but that just looks messy and it doesn't work. It's really not that loud. I mean, it's loud, but you don't have it on the entire time. The only time I turn it on is when I need to spray some water or use the suction or use the handpiece. Nobody has ever complained about the noise, and that's a true story. I do mention it to them, though. I will say to them, oh, and just since you haven't had me before, I'm just going to turn on my compressor unit for a second so you can hear the noise. It kind of sounds like a vacuum. So here we go. So I turn it on and say, see, that's all it is. I don't have it on the whole time. Just if I spray some water, suction, they have the same thing in a dental office, but it's behind the wall somewhere. So you would never hear it, but it's the same thing. And no patient has ever had a problem with that. So don't worry about the noise. In fact, when I first started looking into mobile units, I had asked dental hygienists which ones they were using, and they all said to me, oh my God, they're so loud. Do not get this one, do not get that one. Yet it's no big deal. So I think it just depends on your outlook on the whole thing. It's going to be loud because it's right there, but I'm so glad to have it, right? Otherwise, I wouldn't have suction, I wouldn't have water, none of that. Great question. Is it or is it not the rubber dam mandatory for composite resin fillings? The rubber dam is only mandatory for root canals, and that's because we use a solution called sodium hypochlorite, which is bleach, and water to disinfect the inside of the canal, and we don't want that in your mouth. So rubber dams are mandatory for root canals, but not for any other procedure. But dentists do like using the rubber dam because it keeps the cheeks out of the way. It keeps the mouth isolated, your tongue, everything out of the way. As a restorative dental hygienist, I love the rubber dam. I like to use it too. I do not use it in my mobile practice just because they're very expensive and I don't do fillings like multiple times a day. So I don't use it. I have learned to live without it. But it is really nice to use, and you might notice in dental offices, they will use it on everything and say it's mandatory, even if it's not, just because it's so much easier for them to keep the mouth, to keep the lips, tongue, and everything out of the way. So I hope that helps. Athier, sorry, I probably pronounced that wrong, had said, I just had an interview. The one question was an ethical question. Like, what ethical situation have you been in? And how did you deal with it? Oh, that's a good question. I would ask them to be specific. Like, do they mean with a patient? Or like as a team? Because sometimes, like with ethics, what we often talk about is like, for example, what do you do if you're in a dental office and the dental assistant is cleaning teeth? So dental assistants aren't allowed to clean teeth, but they might pick up a scaler and clean teeth. I don't know. It doesn't happen, but this is just a common ethical question. What do? Do you talk to the dental assistant? Do you yell at the dental assistant? Do you talk to the dentist to get them fired? What do? So it might be that type of ethical question. Well, you would talk to the person first. Say, why are you doing this? You shouldn't be doing this. Stop. If they don't stop, mention it again to them and then go to the higher up, which would be the dentist, and mention something. So usually with any ethical situation, you talk to the person involved and try to resolve it as best they can. What ethical situation did you come up with? I'm curious. And Sonia's asking, have you experienced laser treatment learning? No, I don't. No, I haven't. A lot of dental hygienists do use lasers. I think it's a great idea. I just don't know much about it yet. So I'm sorry, I can't answer that one too well. Is it not mandatory for removing amalgam restorations? Oh, it's not mandatory, but it's highly suggested because when you're removing an amalgam, that's when the mercury and the toxins come out because the heat of the high-speed handpiece is removing that filling, and you need the suction, the high-speed suction right there to suction up most of those toxins, basically. So if the rubber dam is there, that's much better because then it's not going in the mouth. I don't believe it's mandatory. It might be different depending on where you live. Here it's not mandatory, but amalgams aren't commonly used either. Yeah, those ethical situations, it's vague. I would want to have them be more specific. And that's what I would say to them. I'd say, can you be more specific, please? Like, can you give me a situation and I'll tell you how to handle it? I wonder, can you do like a search online, ethical situations and how to answer them? They might give you some examples. How long to study hygiene in Canada? It's about 2 years. If you get a university equivalent, I think it's 3, maybe 4 years, but even I don't have that because here you really don't need it, to be honest, unless you want to teach in a university or teach in a college. I have my own business where I teach online, so I don't need to go to university for that. Plus, I don't want to spend the money and spend the time. No, thank you. I'm fine. So 2 years if you do it the normal, the basic way. Oh, that's smart. So you had mentioned a sticky situation of when you had to deal with a relative's medical problem and what I had to do in a short span of time. That's very smart. Joa, hello. So nice to see you. You're a student of mine, right? Or you were or are, or you just have the same name as one of my students. Sorry. Is asking, what if an office does not perform perio probing for all prophy patients and does not want to? Oh, really? Are they not doing probing once a year? Next question. Itachi, sorry, I probably pronounced your name so wrong. You got your first dental practical. Any advice for practical exams? You are so nervous. Oh my God, I know. Practical exams. You're going to be nervous. I'm not going to tell you not to be nervous because you're going to be nervous. Just do the best you can and remember it will be over soon. And I'm sorry, that's the best advice I can give you. Just make sure you're prepared. Even practice with somebody, like not like clinically, but like practice talking to somebody, how you're going to go through it, the paperwork, all of that. Practice with another student even. You're going to be nervous, but it will be over soon. That's the best advice I can give you. So nice to see you too. So they don't do perio probing at all. That's not good. It should be done at least once a year. Is that the office that you work in? I would just do it yourself. Because as a dental hygienist, you have to. If you're not doing probing, you're not practicing ethically. That's a great ethical thing right there. Somebody's asking, which is better, the laser or the scalpel to do a gingivectomy, and what is your technique? Now, I'm a dental hygienist, so I can't do a gingivectomy, but here a dentist can, and I find that dentists use either one. Laser or scalpel. I think the laser is always better because it's kind of more, well, not more exact, but it's easier to control and not as much tissue damage. But I think it depends on the technique and who's using it. So that's a great question. Ways to fly up is asking, how can I further my hygiene career and increase my income? I am willing to return to college. So you are a dental hygienist at this time, correct? You can start your own business. That, I mean, if you want to, if that doesn't scare you, that is one way to increase your income and continue learning and growing. I became a restorative dental hygienist. That increased my income, but I don't know if they have that program where you live. I also became my own independent dental hygienist, so I have my own mobile business. That has increased my income because I love the dental hygiene profession, but I wasn't happy in the dental offices where I was working. I didn't want to work more because I didn't like it there, but more income's always nice. I have always wanted to start my own business, so that's why I started that. And you can definitely make more of an income doing that. I do offer a course if that's something you're interested in. I'm going to get you the link right now where I teach dental hygienists how to open up their own business because I've done it. Florida, I believe you can. I suggest emailing your dental hygiene association and asking them if you can start your own business. I do have a lot of dental hygienists in Florida who do have their own business, but double check, make sure. You could also start your own teeth whitening business, which I was just talking about. I offer full training for teeth whitening as well. I don't know if you watch my channel, but do a search for like dental hygiene business, do a search for teeth whitening business, and you will find lots of like links and videos. Are you allowed to open up your own teeth whitening business? You might not be allowed to open up your own dental hygiene cleaning business, but you might be able to open up your own teeth whitening business in Florida. I have a lot of students in Florida in my teeth whitening course, but I can never guarantee you're allowed. So please ask them if you can open up your own teeth whitening business. I'm going to give you the link to the teeth whitening business because you can do that on the side. You can make more money and you would be awesome at it because you're already a dental hygienist. Can you see the link that I'm posting? Oh, sorry, I actually gave you my old link. It's the new link is whiteteethschool.com. I would love to have you. You can start making $200 per hour on a client. I bet that's more than you're making now as a dental hygienist. I will teach you how. In fact, the new course just opened up today. So, and I do offer payment plans if that helps. And Michelle is asking, how does dental hygiene school work? Ooh, it's tough. I have videos on my YouTube channel as well. Check them out for a more in-depth conversation. But basically, you learn the theory first, and then you start working on student partners on how to clean teeth, go through entire appointments, paperwork, all of that. And then you see real people. It's very tough in clinic. You basically have to clean off every piece of calculus tartar perfectly, or you fail that client and you have to see another one. That's how dental hygiene school works. No joke. It's very tough. I probably have videos about this too. I cried every day. I cried every day because it was so stressful. I hated it, but it's worth every penny. I love this career, but it's not easy. I've probably just told all of you guys not to become a dental hygienist. That's not what I mean to do. It's totally worth it, but it's not easy, okay? But it's worth it. So Michelle, sorry, I hope it didn't scare you. And it probably depends on where you live too. I went to a hygiene college in Toronto, and here we're very particular. And Zakia, sorry, I probably pronounced your name wrong, but nice name though. Did you ever worry about feeling grossed out by poor oral hygiene before becoming a dental hygienist? Actually, no, which surprises me. I was not worried about that at all. I'm the person where if I see a needle, I pass out. I was worried when I was a dental assistant if I could handle seeing a needle and not passing out, and that was fine. But what I can't handle is oral surgery. So if they're pulling out teeth, if they're like stitching up patients, that just makes me sick. I know, weird, right? That I can't handle. So if I went to school to be an oral surgery nurse or an oral surgery dental assistant, I wouldn't be able to handle it. So it really does depend. But I don't get grossed out at all inside the mouth. I've seen all kinds of things. It doesn't even bother me. It never has. Never. So you shouldn't have to worry. Oh, somebody did ask about fluoride. I'm sorry. In the tap water, I think, but now I don't see it. I meant to answer your question, and it just reminded me because somebody else asked about fluoride, but now I don't see your question. So please type it again if you're still here. Sorry about that. But then, oh, I did pronounce your name right. Of course, I don't remember how I pronounced it, so I'm not going to say it again. But I'm glad I did. Good. I'm horrible with names, so. Is there a problem with over fluoride consumption? No, there's actually not. Around here, I find a lot of patients aren't getting enough fluoride and their teeth are soft, brittle, not good. I feel like we need to be getting more fluoride and adding more fluoride in the toothpaste, mouthwashes. So important. There's the question. Is tap water fluoridated in Canada? In some parts, yes. In some parts, no. I wish it was everywhere. I am pro-fluoride all the way, you guys. Pro-fluoride all the way. It's so good for your teeth. It helps so much. Naughty, I hope I pronounced your name right. I'm sorry. Can you post a video on doing a composite with a dental assistant? You know, I wish I could. I no longer work in a dental office, so I don't have access to those videos. But I bet if you do a search on YouTube, you can probably find some. In fact, when I was a restorative hygienist, I looked up a restorative hygiene student. I looked up videos on like placing composite fillings, placing amalgam fillings. There's lots out there. So definitely have a look. It might not be with a dental assistant, so the tray setup and stuff might be different, but I do have a video about the composite tray setup, if that helps. Just not like a live video because I don't have access to that anymore. And yes, that's true. So usually people do their best to brush before coming in to see us and having us clean their teeth. But sometimes they really don't care and their mouth is pretty yucky, but that's our job. We are there to clean it. So I truly don't mind. What is the best brushing technique? Honestly, the best, if you use an electric toothbrush, I love electric toothbrushes. Just make sure to really like brush each tooth. So don't do this, but make sure to get each tooth and do a good job and be on the gum a little bit, okay? Don't push too hard, that's bad. But that's like honestly the best way to go. I love electric toothbrushes. If you're using a manual brush, the best thing to do is to brush and then sort of sweep down like this, okay? Or the same thing for the bottom teeth. Do this, up, do this, up. So you're pushing the plaque away from the gums, and don't forget the inside of the teeth as well, or the inside, like the inside. Don't forget that. What are some of the hardest courses in dental hygiene school? Asked by Michelle. Pharmacology, oral pathology, those are some of the hardest ones. I do teach them in my course. So I do have a board exam prep academy course for dental hygienists and dental assisting students. And I teach oral pathology. It's a lot easier now because I teach it. But when I was a student, oh my gosh, that was the hardest. And having to memorize all of the different drugs and stuff, oh my goodness, brutal. Very, very difficult. What is your experience to help patient with demineralization white lesions? It's tricky because it depends on the severity of their white lesions. I always suggest a higher strength fluoride toothpaste and a fluoride varnish at the office. That's the best thing to do. It's going to allow those areas to not become worse. If they try to whiten them, it's not really going to help, but it could even things out a little bit, but it doesn't really help too much. If they truly want to cover that up, the best thing to do is get a veneer or a crown even, but a veneer is least invasive, but it's also like $1,000 per tooth. So it really depends. So using a good high strength fluoridated toothpaste really, really helps. Sonia's asking, to become an independent dental hygienist, how many years do I need to work as an RDH? Good question. And yeah, my pleasure. I believe it's 2 years. It's a certain amount of hours. I suggest looking that up because I'm sorry, I just can't think about it on the top of my head. If you look up like independent dental hygiene hours, or even if you ask the CDHO or the CDHA, they will tell you, but it's about 2 years. I became an independent hygienist. Oh gosh, I don't even know, to be honest. I think after 2 years of being a hygienist, but I forget. It's been such a long time. I took the independent dental hygiene course with the CDHA at the time. It was like $400, but that allowed me to be an independent hygienist if I passed the course. So you didn't need like the 2 years experience. If you take their course, I don't even know if it's still available. You can do it without having the 2 years experience. So I hope that helps, Sonia. Okay. Oh, so you are a dental hygiene student. So you still don't know the answer to this. Do you aim the bristles at a 45-degree angle with an Oral-B brush? I've seen so many different options from dentists online. If you're using an electric toothbrush, you don't angle anything because you can actually brush away the gum or make it sensitive. I wonder if I can look up some images for you. Let me see. With an electric toothbrush, you just want to focus on the teeth, like each tooth at a time. But a manual, yes, you want to angle the brush 45 degrees, like circle and then brush down. It's called a modified Stillman technique. So I didn't mention that at first because I didn't realize you were a dental assisting student. I'm just seeing if I can find an image for you guys, and then I'll get back to the questions. Sorry. Are you in my course? Because I do have all the brushing techniques in my course. I just can't find it online really quick. So definitely have a look if you are, or just go and look up toothbrushing techniques. I just can't find any on such short notice, of course. Go figure. But I tried for you. Do an online search for toothbrushing techniques and click on images, and you should be able to find some there for you. So does that help to answer your question a bit more? Juan, I'm probably pronouncing your name wrong. Sorry, Zuan. Sorry. Nice name though. Is asking if a client comes in without brushing and there is a lot of plaque and it interferes with your debridement, do you often do polishing first and air polishing? Yes, I will polish first. If there's a lot of plaque, I polish first. For kids, I polish first all the time and then scale if needed. I've had a lot of hygienists say that they're now polishing first and it saves them so much time. I just don't, because I'm still in the habit of just polishing last. But that will definitely save you time, especially if there's a lot of plaque. So I hope that helps. Danny is asking, what do you wish you had known about periodontology, trying to anticipate this next semester? You know, you'll learn a lot. I can't really say what I wish I had known. That's a tough question. You will definitely learn a lot. There's no way to really pre-study for periodontology. Like, you'll just learn it and kind of go from there. Are you inside my course, the Board Exam Prep Academy? I can leave the link for you guys if you want. But you could always listen to my lectures on periodontology. Watch the videos, read the material first, and then you'll be really prepared for when you start your program in school, and you'll be ahead of the game. So you could always do that. I'm going to send you guys the link to my course right now for the Dental Hygiene Board Exam Prep Academy. There's lectures, there's videos, there's mock exams, even if you're not taking the board exam soon. If you're a student, if you are a dental hygiene student still in college, this course is for you, because I teach you guys everything and you'll be that much further ahead for your actual classes. So I posted the link for you guys. Check it out, because that will really, really help you. And you'll feel more confident too. You'll learn things before your classmates, so you'll kind of be a step ahead and just feel better about it. Someone's asking, is it healthy if the margin of the filling or crown is inside the gingiva? Inside the gingiva? So you mean the gingiva is sort of like overgrown a little bit? That's not bad. The bad thing is when the margin is just not near the gingiva at all. Like if the gum is starting to recede and the crown margin is just so low, that's when it's not good. But if it's under the gum a bit, I would actually say that's awesome. And that's what it should be. Oh, okay. So you're saying that you remembered all of the brushing techniques. Good for you, because they're hard to remember. You just weren't sure about the Oral-B. So that's a great question. So think electric toothbrushes. There's no toothbrushing technique. There's not. But I don't know what they taught you in school. They might have picked one. I don't know. But the electric toothbrush is just focusing on each tooth and maybe a little bit on the gums, like just to make sure you're not missing the gums, but not on the gums too much. You're not doing like modified Stillman, none of that. It's just focusing on each individual tooth, especially the Oral-B, because the toothbrush head is like a round brush head. So you have to focus on every tooth. Think of like when you're polishing. There's a round brush head, so you polish each and every tooth, right? And thank you guys for liking this live video. I see that there's some likes. That's fun. Guess what? It's 7:44, you guys. We have a couple more minutes left because I did say I would come on live for you guys for an hour. Any other questions? I hope I'm helping. Can you give the steps of the sealant application? Oh, great question. So I have to always think about this. So you would pumice the tooth. You do not use toothpaste or prophy paste. You would use pumice and water to create a paste. You would polish the occlusal surface of the tooth because that cleans it. Rinse, dry. You would apply the etch. Wait 10 to 30 seconds depending on the type of etch you use. Suction that off, rinse, dry, make sure there's a chalky white appearance. If there is, you're good to go. Make sure to keep the area dry, dry, dry. If it's not, you'll have to do the etch again. Dry, dry, dry. You would apply the sealant. I like using either a micro brush or a Dental Explorer to run through the sealant so there's no air bubbles. Make sure it's as thin as possible, because if it's too thick, then the patient will be like biting on the sealant, and then you have to polish it down with a high-speed handpiece, and only a dentist or a restorative hygienist can do that. You would apply the sealant, light cure for 30 seconds or more, depending on the manufacturer, and check with the Explorer to make sure the sealant stays on, and done. So does that help? That was very quick. That was a Pitt and Fisher sealant application. Great question. Yes. The recording, this is being recorded. I process it and then it goes on my channel as public as soon as it's done. Oh, you are from the UK. Great. Hello. What time is it there? It's almost 8 p.m. here. Nodira is asking, do I have any advice for the dental assistant board exam, tips and resources to study? Yes. I have a dental assisting board exam prep academy. So a full course. I'm getting the link for you right now. I suggest signing up for my course. Obviously, I'm going to say that because it's my course, but I will help you pass, because what I do is I give you all the videos, all the material. You get mock exams and tutoring with me as a group for more mock exams. So I teach you multiple choice type questions and picking the best answer. That's the best way to pass your exam. So I left the link for you. I hope you can see that. I can help you. When do you take your dental assistant exam? Study every day, 2 hours minimum, 6 hours maximum a day. I like to say 2 hours in the morning, 2 hours in the evening, 2 hours in the morning, 2 hours in the evening, and 2 hours in the afternoon. I did that again, opposite. But, you know, that really helps you learn as much as possible. If you sign up for my course, I tell you exactly how to study, when to study, and you get mock exams, everything. Thank you guys so much for clicking like. That's awesome. I don't know if I get anything when you guys click like. It's just nice to see that people like my videos. So I hope that helps. Nari is asking, what are my thoughts on becoming an orthodontic hygienist and the requirements to be one? I think You know what? Every dental hygienist wants to be a ortho hygienist because it's less messy. Your patients aren't nervous. They're excited to be there because you're doing ortho. It's a lot easier. You don't need to take a specific course for it in school, but when you work for a dental office, they will likely guide you to what course to take. I'm not an ortho hygienist. It does depend on where you live, so I can't give you specifics, but every hygienist loves to be an ortho hygienist. It's the way to go. Shea is asking, you start the dental hygiene program next month. Oh, good luck. That's exciting. Oh my goodness. Did I send you guys the link for the dental hygiene board exam prep academy? So I can help you. You can sign up if you want for my dental hygiene board exam prep academy. I help you every step of the way. And this is kind of nice because you can go through topic and learn about the topics before you start your program. Or let's say once you start your dental hygiene program, you're doing oral pathology next month. Well, you can get a head start and read up on it early. Plus, it just helps you answer questions, be better prepared, all of that. So, of course, I'm going to recommend my course. I did post it for you, but that will help you succeed in your program and be more confident and less stressed. You will be studying all day, every day. Seriously, and at night. So I actually suggest resting now while you can. Okay, I'm not even joking. You will be studying every night. You'll be working hard, but it will be worth it. Okay. Feel free to reach out to me if you need any help because I would love to help you. What's your thoughts of working at a temp agency versus a private practice? Junia, I did actually talk about this a bit earlier, so definitely make sure to watch the recording. But I liked temping because you go into a new office every time. You typically get paid more. They're so happy that you're there because you're helping them. But it might be more stressful for you being in a new office every time. Everybody's different. I liked being a temp, but some people don't. But then I like just being in a private practice too, because you saw the same people, the same patients, you knew what to expect. So it really depends on what you prefer. But you do get paid more typically as a temp. But you don't get benefits either if you get benefits. So it's kind of hard to say. Oh, so it's 12:46 a.m. in England. Oh my God, you must be so tired. You should go to bed. Thank you so much for watching. It was so nice to talk to you. Zakia, did I pronounce it right this time or did I do it wrong? I'm sorry, but thank you so much for listening to me. The recording will be up. Don't worry, you should go to bed. Have a good sleep tonight. Oh, thank you. Yes, it is not easy having your own business, but I wouldn't change it any other way. Even like today, we had a lot of snow. I run my own business, so I just called my patient and said, snow day, we can reschedule. She's like, no problem. Whereas if I worked for a dentist at a dental office, they probably would be mad if I said, I'm not coming in, the snow's crazy. So it's nice to just have your own patients, have your own schedule, make your own money. You make more having your own business. If you guys do take my course, either my teeth whitening course, so I teach you guys how to open up your own teeth whitening business, or I teach you guys how to open up your own mobile dental hygiene business. If you are a dental hygienist, I teach you guys how to be successful. So not to just how to open up a business, but how to actually make money. So I've had my own business for about 2 years and I have about 300 patients. That's pretty impressive if I do say so myself. So, and I make a full-time income easily with part-time hours. So you guys can do it too. So thank you for saying congratulations. Let's see. Somebody's asking, is the fluids containing acids bad for the enamel? Unfortunately, yes. But I tell people if they drink anything that is acidic, such as apple juice, alcohol, anything, have a drink of water because water is a neutral pH that will bring the mouth to a 7, which is a neutral pH right away. So then it's not bad for your enamel if you have water. because water just helps to neutralize those acids right away. Junia, do I receive a 1099 form from the actual temp agency or the actual practice? I don't know. Where I live, we didn't get those forms, but I know what you mean. It's different everywhere. So I would ask a temp agency if they supply them. If they don't, then it's the private practice. So that's a great question. La Toya is asking, I am a temp assistant in Northern Ohio, USA, but I have noticed there are more opportunities for work for hygienists than assistants. I personally like temping. I'm also in school to become a hygienist. Oh, that's great. I was a dental assistant first, and then I became a dental hygienist as well. So good for you. That's amazing. Oh, good. I did pronounce your name right. Yay. You can work as a dental assistant while in hygiene school if you are a certified dental assistant. Some people think if they aren't a dental assistant, but they go to dental hygiene school, they're automatically a dental assistant. No, you have to be certified as a dental assistant. In some cases, you can open up your teeth whitening business if you are in dental hygiene school, which I teach you guys how to do that. I'll leave the link for you if you want to check it out, because the course is now open again as of today. So we start today, and it's learn at your own pace online. And my dog is just doing a big stretch, so I was just checking her out. Hi, Hope. Are you tired? She's tired. I don't know if you guys would like to see my dogs. They're just resting. I'll show you guys. Say hi, Hope. And Teddy's behind her, but you can't see him. Hi, Teddy. Hi, Teddy. No, he's sleeping. Okay. Sorry, guys. He's sleeping. My pleasure. I can answer you guys a couple more questions if you like. 5 more minutes. Believe me, I could do this all night, but I should probably let you guys have a good night first. And thank you so much for clicking like, you guys. I do upload new videos on my channel a couple times a week. So if you guys like them, click like, make sure to subscribe, and listen and watch my videos. It's just nice to know that people are listening and watching. That's fantastic. Ashley, in Canada, it doesn't matter. We used to have a program like 15 years ago where if you became a dental assistant first, that took a year off of your hygiene program, but not anymore. Dental assisting and dental hygiene is completely separate. So for dental assisting, it's typically 1 or 2 years, depending on where you go. Mine was 11 months 15 years ago, but that was 15 years ago. And dental hygiene is typically 2 or 3 years. Same thing depending on where you go. My program was 2 years, but I took dental hygiene twice. I have a video on that too. I went to a private college that actually shut down and went bankrupt 3 weeks before I was supposed to graduate. Yeah, I know it happened. So then I went to another hygiene college in Toronto. So it took me 4 years in total, probably even a bit longer, like if you take into account everything. So yeah. But that won't happen to you guys. Your school will not shut down. I was just unlucky. But I like to say everything happens for a reason, and that's why I'm so passionate about this profession, and that's why I tutor, because I know it's tough. And I'll give you guys my main website if you guys want to check out any of my courses. It's dentalelle.podia.com. I have it in the description of all my YouTube videos as well. I teach dental hygiene and dental assisting students how to pass the board exam, how to do better in their school program so it's not as stressful. I teach you how to start your own teeth whitening business. You don't have to be a dental professional to start your own teeth whitening business in some cases. I offer consulting on dental hygienists, how to start their own business as well. I do a little bit of everything. If you're a dental professional or a student, I love what I do and I love to mentor. So I would love to help you guys. Okay, you guys. Well, thank you so much for coming on live. This was fantastic. I'm going to end our live session now. And this has been recorded, I think. And the recording will be up later on this evening as soon as it's processed. So thank you guys, and feel free to watch more videos if I'm interesting to you. Yes, there's a separate test for Canada and there's a separate test for the States. The state exam is a lot harder apparently, and there's more sciences involved, but I do tutor for both. So if you need help, I'm more than happy to help you, Latoya. Check out my website. I have all the courses there. And if you guys are signing up for my teeth whitening course, any of you, we did start today, but you can learn at your own pace and you get full access right away. So you will be emailed your username, you create your own password, you log in and see all the lectures right away. And then we meet actually online tomorrow where I talk to you live, and we have our first class. Thank you guys. Well, you guys have a great night. I do hope I helped a lot of you guys answer your questions. Have a wonderful evening. The next time I do a YouTube live, I'm going to comment in the community post again a couple hours before, because sometimes I don't know when I'm coming on until that day. So I'll let you guys know. I love to answer your questions. Thank you guys so much and have a great evening, okay? Thank you guys. Bye for now. Bye, guys. And thank you so much for watching.